Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming live on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director at WNCU 90.7 FM. We're using the Zoom platform to talk about how COVID-19 is affecting our world. I have the pleasure today to have as my guest, Dr. Sharonda A. Robinson, epidemiologist and Eagle Pride Blood Drive Coordinator at North Carolina Central University. We're going to talk about North Carolina Central University as a COVID-19 vaccination site. Hello, Dr. Robinson, and welcome to COVID Conversations.
Hello, and thank you for having me.
You are so welcome. And I can only imagine that you have been as busy as a bee this week.
Yes, ma'am, it's been quite a week. It's been exciting.
Well, that's really good because, you know, when you talk about somebody getting a shot in the arm, usually people have a little flush of fever before they have to go and get the needle. So North Carolina Central University launched its very own COVID-19 vaccination site this week with hopes of vaccinating the greater NCCU community. What made North Carolina Central a good fit as a vaccination site?
North Carolina Central University is a great fit to be a vaccination site because of its location in the community and its relationship with the community. So it's a welcoming environment for people who may have had some hesitancy about going to other places or may have had questions about going to other places to receive their vaccination. For them, it's like coming home, you know, to get that nurturing that we're accustomed to giving.
And I can only imagine like somebody stepping out of their front door or back door or wherever they live adjacent to NCCU and just be able to go over to the Walker Complex to get
coming right over.
Yeah. So I've been, like searching the world over to try a vaccination site. Can we talk about like the African American community in general? I know that there's been a lot of information, a lot of research done in the Black community where the mood is that African Americans are very hesitant to get the shot. So can we talk about maybe some history of that hesitancy? Why are we not going to get the shot en masse?
Sure. I also work with the African American, with the Advanced Center for COVID related disparities on campus. That's our core unit. And we have been doing some research on the African American community and hesitancy. And though there is some hesitancy, we have seen some decline in hesitancy as we progress in dealing with COVID, as the cases rose, as we got closer and closer to the development of a vaccine, and now in having a vaccine. So there has been a decline in hesitancy, but some of the reasons indicated for the hesitancy, of course, is the mistrust of the government, people feeling like this vaccine was made too quickly. And then, of course, there are people who just want to wait some time or wait until other people have received it before they go to get theirs. And so with the mistrust with the government, a lot of that, people say is based on the previous Tuskegee syphilis experiment. Well, the difference between that and COVID is that at that time, treatment was withheld. But now we're trying to give people treatment to prevent something that is causing a large number of deaths, as we've seen. So we're trying to keep not only African Americans, but the whole population from succumbing to COVID-19. In terms of whether or not this vaccine was created too quickly, they've been working on vaccines of this nature for almost a decade. So with this, it had to just be modified to fit the actual COVID virus. Additionally, you had resources from all over the world. Everybody has been focused on combating COVID. So that's how we were able to develop this vaccine at what seems to be a quicker rate. And then in terms of, waiting for other people to get it, where we're now in stage 3. And so there have been quite a few people that have received this vaccine. So for those who wanted to wait and see, once your stage comes up, I encourage you, to make an informed decision and get in line.
So the wait and see population, I would imagine that they wouldn't want to be first in line in case something was really wrong with the vaccine and they might have some ill effects from it. So what was the mood when people came to talk about the vaccine? Was there any of that apprehension?
Well,
They were just
actually, when
there.
people came to our clinic, they were excited to finally have the opportunity to receive the vaccine. As you mentioned earlier, there have been a number of waiting lines. People have been calling far and wide to see where they can get the vaccine. And also people have been waiting because they weren't in the eligible groups to receive it. So once it became available, more people wanted to receive it, but either they weren't eligible or it wasn't available. So now that it was available, they moved to stage 3. So larger groups of people were available to receive it. They were excited to have the opportunity to finally receive it.
Okay. NCCU is one of a limited number of universities that have been approved as vaccination sites. So how did that come about? Like, who were the powers that be that said, we're going to make the vaccine available at NCCU?
Okay. Well, actually, under the leadership of Dr. Mari Ross Alexander, who's over our health department, she and Dr. Angela Coleman, Dr. Kristen Long Witter, they were the leadership of a team of people on campus who worked together to make NCCU a vaccination site. But I would credit a lot of that to Dr. Ross Alexander and her wonderful leadership in these efforts.
So who was the agency who came to NCCU?
Okay. So Dr. Ross Alexander, she applied to the state or health department, and she also spoke with the people at the Durham County Health Department. So actually this first allocation came through a partnership with Durham County Department of Public Health.
Oh my goodness. So then how many vaccinations were available through NCCU?
Well, with this first round, we had 700 vaccinations available.
700. And then today is Thursday.
Yes.
This is the last day of the vaccination.
Mhm.
And how many doses have gone so far, or did you allocate as many doses as you had appointments? So did you have people to fill all of the spaces?
Well, actually, we had people on a waiting line. We had 200 people on a waiting list. And so some of the days when people didn't make a point or didn't show up for their appointments, we did allow some walk-ins who were eligible to receive doses. And we also continued to make calls to those people who were on the wait list for them to come in.
Okay. But in total, you had how many doses was it?
We had 700 doses in total.
700 doses in total, and you were able and capable of handling all of the traffic that came through over the last couple of days.
Yes, we were very much capable of handling that traffic with the work of the nursing students who are assisting in administering the doses. We have public health education students running the registration, and we have other students from across the campus serving as runners and volunteering. And again, under the leadership of Dr. Ross Alexander, Dr. Kristen Long Ritter, and Dr. Angela Coleman, they are making sure things are flowing seamlessly.
That's amazing. So you were talking about the different stages. So in this stage, people were eligible. Could they come up from 1 and 2? And
yes,
or was
that
it
is correct. 1,
Mhm.
2, and 3. Anybody who is eligible in phase 1 through 3 could receive the vaccination.
So how many people would you estimate took advantage of it who were employees and students at NCCU?
Well, we've had quite a number of faculty and staff to come through. The students that are eligible are those who are frontline workers or who actually volunteer in capacities such as this, where they're interacting in a clinical nature with the community. So we've had more faculty and staff to participate than actual students.
So briefly, you mentioned like the nursing department.
Yes.
This process. So how were they involved? And then what do you think it meant to the nursing department to be able to participate? And was this like a clinic setting for them?
This is very much a clinic setting for them. So under the leadership of Dr. Yolanda Van Riel, her students, her faculty, some of her alum, they've all come together to volunteer their time to administer the medication. They've been administering not only at the NCCU vaccination clinic, they've also been working with Duke clinics and other community clinics as well. So they were excited about the opportunity to work at NCCU.
Very good. So the Johnson & Johnson vaccine is what you're offering, or what was offered in this clinic.
That is correct.
Right. So people are going to want a second dose. So if you're planning to do other clinics, will those people be at the head of the line for a second dose, or would you try to administer a first dose to people who would come in who haven't had an opportunity to get the vaccine yet?
Well, that's the beauty of the Johnson & Johnson vaccine. There's only one shot. There is no second dose. So after you take that first shot, that's it. You do not have to return to any clinic for a second dose.
Very good. That's what I'm talking about, because I would be so afraid to get the second shot. So why do you think that the Johnson & Johnson shot was administered at North Carolina Central University over Moderna? Was it because of the way that it had to be stored, or how was that shot made available to NCCU?
Well, actually, NCCU is capable of distributing either of the three vaccines. So we do have the proper storage capacity to distribute either of the three, but sites do not know which vaccine they will receive. So you just get the one that you are distributed. And this happened to be the one that we were distributed for this week.
You didn't have any leftover vaccines, you said. How many clinics will you have in the future? Is there any plans to do this again?
Okay, well, actually, the clinic is still going on today. So it's still open through 6 o'clock today. So vaccines are still being administered. But we are planning to continue to do this. As long as we receive allocations, we will continue to be a clinic. So we're hoping to get another allocation in next week, and we will know more about that this afternoon.
Very good. So you know more about it this afternoon. And then how can people sign up? Do you have to have identification when you come to get your shot? How does that work?
So initially, a link went out through emails, and people distributed to friends and family. There were also news PSAs that went out to inform the community. There are various flyers that are going out. So, it's posted or shared on social media. And so when it goes out, again, there is a link for you to express interest and indicate your eligibility. And then when you show up, you do not have to have insurance or anything of that nature.
It's free. You just show up.
Yes, it is free. You just show up
and say who you are
and be in an eligible group.
In an eligible group. Well, I'm just so happy that North Carolina Central University is involved and is able to be a clinic for the vaccine, especially in the community where North Carolina Central University has been a part of for so very long. So Dr. Robinson, is there anything else that you'd like to share with us, maybe that I didn't ask?
Well, I think part of some people's hesitancy about receiving the vaccine are the side effects that they've heard about. One of the benefits of the Johnson & Johnson vaccine is that because it is one shot, then a lot of the side effects that people have heard about are more so associated with that second shot. But you know that each vaccine can have a different impact on different individuals. With me, for example, I received the vaccine at the NCCU clinic this week, and I only had mild side effects. In fact, my main side effect was just muscle tightness. So, and that's to be expected with any injection. And the side effects impact different people differently. And for some reason, my eyes were kind of dry and watery for a day. But that was a very unique response to me because I haven't heard of that happening with anyone else. But like I say, just that muscle soreness, and I'm feeling great.
Maybe with your eye dryness, you could be a case study.
one individual study.
One individual study. Well, Dr. Robinson, thank you so much for sharing your time with us today. It is very much appreciated.
Oh, I'm very appreciative of having this opportunity to speak with you and to share with our community. I encourage everyone to take the steps necessary to protect themselves, to protect their loved ones and their community. And even with vaccines being available, I want people to continue to practice the 3 Ws, wearing their mask properly, washing their hands, waiting 6 feet back, refraining from large gatherings and crowds. So this is not over yet, even though people may be experiencing COVID fatigue. We still have to hang in there and take the necessary precautions.
Well, Dr. Robinson, thank you for doing what you do.
Oh, it's my pleasure. And I encourage everyone that as we continue to have our clinics at NCCU, come on out. When you're eligible, come on over to our clinic.
Okay, thank you again. And thank you, audience. You've been watching and listening to COVID Conversations here on WNCU 90.7 FM. Be sure to follow us and subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host. Until next time.